work 20 hours a week at least, but don't have insurance, we're your guy. That is tens of thousands of people in Shelby County that qualify. As you probably know, Shelby County is about 850,000 people. Memphis is about 650,000. 2 years ago, the benchmark for uninsured was 142,000. We have 29.5% poverty level in this city and county. So there's the challenge. So what are we going to do about it? Memphis, Tennessee is a town that finds solutions. That's what we do. We cut the hole in the fence and we go. That's what I hear, right? So Dr. Scott Morris, who was in divinity school at Yale, decided he was called to a healing ministry. And to show that he was fully committed, he graduated and then enrolled in medical school. That's a pretty big commitment if you ask me. And then when he finished, he wanted to fund a town in the U.S. that had a lot of poverty and a lot of need. And you don't really have to throw a dart to come up with Memphis. This is it. So he moved here not knowing anybody and started this ministry that serves the working poor. And that's a lot of folks. It's the people that dig the ditches, to pour the concrete, to build those houses, which we want to insure and clean and sell, right? It's the people that check your groceries. It's the people that do all kinds of things for you, that work very, very hard, but don't have a place to go when they're sick. I mean, we hear about people going to the emergency room, and that's true. The emergency room takes a lot of folks. It's the most inefficient way to treat anybody. But more important, if you go into the emergency room and you've fallen off a roof, your arm's all shattered, they're obligated to treat you and put you in a splint and stabilize that. They're not obligated to give you reconstructive surgery. You're stuck. They'll give you the phone number of a surgeon that might charge you $20,000 or $30,000 when you're making $9 an hour. So literally, there are people that have nowhere to go. That's where we fall in. There are other entities in the community that are great, so we try to find a continuum of places for people to go. Christ Community Health Services, wonderful organization. They're not my competitor. We cooperate. They treat people that are eligible for TennCare, Medicaid, other things that my people don't have. Memphis Health Center, same sort of thing. So between us, in 30 years, we've had 70,000 patients. Last year alone, 49,500 patient visits. That's a lot. Christ Communities has about 50,000 patients. Neither of us want 100,000 patients because we just can't handle it. So I need all of my friends in this business to do well, just as all of you around this table have complementary businesses and need each other to do well. That's what makes our economy work.